Welcome to the Causes or Cures podcast, your gateway to understanding health and groundbreaking medical research in a fun and easy to understand way. With Dr. Eeks as your host, join us as we sit down with the world's leading doctors and scientists to unravel the mysteries of health. From practical tips on well-being to the latest breakthroughs in medical research, we cover it all. Don't forget to subscribe. Now, let's ignite our curiosity and together dive into today's episode.
Hello, everybody, and welcome to this episode of Causes or Cures. I'm Dr. Eeks, your host, and thanks so much for joining in wherever you are in the world. Welcome, welcome. So today, I will be chatting with Dr. Carlijn Wagenaar, and she's going to walk us through the plants for joints research for rheumatoid arthritis and osteoarthritis. So RA and OA, you guys might know them by those letters. And this is not just about food or eating plants. This is a whole plant-centered lifestyle. Plants for joints. I almost said joints for plants, which really gives you kind of a fun mental image there, doesn't it? You crazy house plants. All right. In this episode, really quick, this is what you'll hear. What the study design looked like. So who was in it, how long it ran, what a plant-forward lifestyle meant in real life in terms of meals, movement, sleep, stress tools, the primary outcomes they tracked for rheumatoid arthritis and osteoarthritis, and what changed for the participants, why they built in hands-on cooking classes and weekly support instead of just handing out a diet sheet, the biologic why eating plants helps improve joints. Participant takeaways, what people thought about it. So if you want an evidence-based look at how a plant-centered routine, not just a menu, can move the needle in rheumatoid arthritis and osteoarthritis, basically for your joints, right? And our joints all seem to go as we get older. You are in the right place. So sit back wherever you are. If you're driving your car, I think a lot of people listen to this podcast when they're driving their cars, which is cool, or running. Anyways, give me a few seconds while we connect to Carlijn and hear what she has to say. All right, everyone, we are connecting with Dr. Carlijn Wagenaar, and we're going to talk about this cool study that she and her team did. But first, Carlijn, can you tell us a little bit about yourself and what you're doing and where you are?
Yeah, so I'm currently in Amsterdam, the Netherlands. I was born here, and when I was 2, I actually moved just outside of Boston. So I grew up, in Wellesley, Massachusetts, until I was 16 years old, and then I moved back to the Netherlands for my father's job. He was also in research, and then I graduated high school here, went to med school in the north of the Netherlands, and then after that, I went into research, and throughout my medical education, I got very interested in the power of preventative medicine. So how can we keep people healthier using, exercise, healthy nutrition, sleep, and stress management? And especially the nutritional aspect, I think, sparked my interest the most. And that's also why I got involved in, different associations. So, for example, trying to implement nutritional education within the medical school system. But also, for example, doing various research projects as a medical student. And that's why I also got in touch with, the Plants for Joints researchers. Gladly, I was able to join that team right after med school. Yeah, now I'm going to be completing my PhD in November. So it's
good
been
for you.
Quite a while. Yeah, thanks.
You're close. That's
I know.
less than 2 months away. That must feel good. So since you've lived in the US and the Netherlands, but you went to medical school in the Netherlands. So what do you think the difference between the two countries?
There's a lot of differences. I think as a teenager, what I really liked about being here was the freedom. So, for example, you may know that, but we bike almost everywhere. And I think, as a teenager, that's pretty cool that you kind of just don't have to drive everywhere with your parents. I think what I really liked about the US, especially, was the sports integration in high school and also middle school. So I did track, I did lacrosse, soccer, all that kind of stuff. And I really miss that here. So I think there's definitely plus and minuses growing up. And I think, yeah, in terms of university and college, there is big differences. For example, our medical school here in the Netherlands is 6 years. So right off the bat, after high school, you go into med school. If you get selected, and in high school, you kind of tailor the subjects you take to what you want to do in the future. So you do have to have an indication of what you want to be doing. For me, it was quite clear that I wanted to go into medicine. And so, yeah, I got into med school. And then it's kind of a fast tracked 6 years, and then you're done.
Yeah, that's nice though. I mean, if you know you want to be a doctor, I guess if you don't know what you want to be, might be like you have to go back. But you mentioned that you were trying to get or working towards getting nutritional classes in your med school over there. That's an initiative over here now with our new administration. They're trying to do that. Has that come to fruition over there? Or is it slow moving?
I think there's definitely more awareness about like the power of healthy nutrition and food, and the effect that it has on our well-being and also the relationship with diseases. I think certain universities are integrating it into their curriculum, but it isn't as, yeah, I mean, it's a slow process. But I definitely think since that when I graduated from med school, I think there definitely is a lot of progress.
Yeah.
And a lot of young doctors are a lot more interested in lifestyle medicine.
That's
so I
true.
think that's really promising.
Yeah, no, that's absolutely true. Of course, in the US, we have a whole other healthcare system that's we're always fighting about because it's expensive and all of that. Goodness gracious. I've done so many podcasts on that, on like the US healthcare system, and it's unaffordable for so many, but you guys don't have that. Not as bad
Well, I
either.
think, well, we call it, we call it zorginfarct. It's essentially a healthcare heart attack, which a lot of Western countries are going to have. The problem is people are living longer, but they're
Yeah.
living longer with chronic disease. So in the Netherlands, the average person gets their first chronic disease at 43 years old.
Wow.
And if we compare that to, for example, 50 years ago in the Netherlands, it was 54 years old. So we're living longer, but we're living longer in poor health. So this costs a lot of money. We're also seeing that we will not be able to keep up with the amount of old people and the amount of chronic diseases. So this costs a lot of money. We won't have enough healthcare professionals to tackle that. So I think that's why there's also a lot of initiatives. How do we prevent people from getting chronic diseases? And also, how do we make the care more efficient? And that's also, I think, where technology really comes in. But that's why I also think this is really interesting, because this is, solving a lot of problems that we have now and will be facing in the future as well.
Why do you think people are getting chronic illnesses at younger ages?
One of the main things that we think it lies with chronic inflammation. So inflammation is normal, necessary. When you cut your finger, it becomes red, swollen. It's necessary for the healing process. The problem is if you have this inflammation all the time for a really long time, this increases the risk of a lot of various diseases. So often you see this as metabolic syndrome. So various risk factors like high waist circumference, blood cholesterol, high blood glucose, also type 2 diabetes, heart disease, cancer. But we also see, for example, the relationship between this chronic inflammation and osteoarthritis, and also with, for example, autoimmune diseases like rheumatoid arthritis. And when we look at what's causing this inflammation, various environmental and lifestyle factors play a role. So for example, an unhealthy diet, so a diet that's very high in processed, but also animal-based foods, high in salt, high in sugar, not moving enough, so a very sedentary lifestyle, chronic stress, and for example, a low quality of sleep. Those factors all kind of stimulate and create this chronic inflammation. And if people have that for a very long time, this increases the risk of those diseases. So that's, really also what we target with our study to try to reverse or minimize the inflammation.
Yeah. I mean, the first part of your study, when I was reading the background, you talk a lot about the chronic illness in general, and what a burden it's going to be. So plants for joints, tell us about that. I love the name. It's such a catchy name.
It is. I think it's funny because I think in Dutch, it's people don't associate like joints with other things. It's only later that we were like, oh, joints is other things as well. Oh, what are plants? So it's quite
also
funny.
because you're like in Amsterdam, right? And
I know it makes it worse. It makes it worse. Yeah.
Or it makes it better. But I like the name. So when did that come about, and what's the background story there?
So my boss, and he was a rheumatology professor in Amsterdam, Dirk-Jan van Schaardenburg, he was always very interested in early onset rheumatoid arthritis and also the prevention of rheumatoid arthritis. And so he's always been integrating this lifestyle component and healthy food within his practice. And my other colleague, Wendy Walramenstein, she's a dietitian, and she was very into more plant-based nutrition and the power of especially reducing that chronic inflammation and reducing this chronic disease risk, and also helping to treat these diseases. And she had a friend who went to the rheumatologist and was under the care of Dirk-Jan, and her friend told her, hey, this is really interesting because a lot of the things you're saying, my rheumatologist just told me. And then Wendy, my colleague, was like, oh my God, I need to talk to this rheumatologist because this is so interesting, and a lot of doctors really aren't implementing this in their care. So Dirk-Jan and Wendy got talking, and this whole Plants for Joints idea started. And that was really the beginning of our study. And then later, I also joined in as a student, and later as a PhD student. And essentially, what this Plants for Joints study is it's 2 randomized controlled trials. So we conducted one in people with rheumatoid arthritis with a mild to active disease, and then one in people with osteoarthritis. And just what is the difference between these diseases? Some people might not know that, but rheumatoid arthritis is an autoimmune condition. So in this case, there's auto antibodies, so immune cells fighting against their own body. And this creates inflammation, pain, swelling of the joints, and also stiffness. And it can have a lot of other symptoms as well. And then when we have osteoarthritis, we really see a degeneration or a losing of the quality of the cartilage. And this often happens in the hips or knees. And for example, in the Netherlands, but in many other Western countries, about 10% of the population has osteoarthritis. So if you know somebody who has, a painful knee or hip, it's oftentimes osteoarthritis. And although we see a larger inflammatory component with rheumatoid arthritis, we also see that in osteoarthritis, this inflammation does also play a role. So we had these 2 populations of people. And the reason we did this study also is because we had some background information from previous studies showing that there was potential beneficial effects of a more plant-based diet for both conditions, but also the synergistic effects of combining healthy nutrition with exercise, stress management, and sleep. And that's also why in our study, we combined all those factors with the idea, hey, then it'll probably work better. Right. So we had our 2 groups of people, and we randomized each population either to a standard care group or to our Plants for Joints intervention group. And in this Plants for Joints intervention, we conducted a 16-week intervention in which people initially started with a cooking workshop. So we taught them how to cook healthy meals, plant-based meals, also what it tastes like. And it oftentimes also requires some different skills and some different ingredients in your kitchen. So we really taught them how to do that from a informational but also practical standpoint. And additionally, they had 9 other group meetings within a 16-week period about exercise, sleep and stress management, and so forth. And then what we really did is we compared the effects of this intervention after 16 weeks, looking at, for example, disease activity in people with rheumatoid arthritis as compared to the control group. And this score called the WOMAC score, which is essentially a questionnaire which is validated for osteoarthritis, looking at pain, stiffness, and physical function for people with osteoarthritis. And that's where our RCT results also come from.
All right. So that was a great explanation. Very, very thorough. Now I have to ask, so in the plant-based diet, was meat allowed at all?
So we didn't give people meals. So really people were handed practical and theoretical information about what they were doing, how they would do it, and why.
Okay.
And we really encouraged them to follow a whole food plant-based diet. So this is a diet, which is essentially a vegan diet, but a healthy variation of a vegan diet, also based on our Dutch dietary guidelines. So it entails whole grains, legumes. So think beans, kidney beans, chickpeas, lentils, also soy products, nuts and seeds, fruits and vegetables. So that's really the core of the diet. Obviously, in the real world setting, people are going to make exceptions. Although we saw that people were very adherent to our diet, and it was also a very motivated group.
Oh, well, that's good, because adherence is always an issue with any kind of intervention, right? Getting people to do it, and but behavior change too. And the cooking classes sound kind of fun. Was that virtual, or everybody showed up in a room with a skillet or something? I don't know.
No, it was, first of all, they were super fun. And I think people really remember that as one of, the nicest part of the study. It's a great introduction. You meet your colleagues and other people in your group. At the start, it was all live. So we did all 10 group settings in the hospital together with them. But a couple months after we started, COVID actually came. So all of a sudden, everything had to be online. And then once the regulations were a bit less strict, half of the meetings were live and half were online. So we, have kind of variations online and in person.
That's right. Running a research study during COVID, that must have been fun.
It wasn't.
No, I know that was sarcasm. I think. No, but you guys adapted and overcame and went through with it. Yeah. Wow. Jeez. Okay. So people enjoyed the cooking class? Did people enjoy the taste, of the food? Did you get good feedback? Because sometimes you don't, right? Like if you switch to like a healthy diet, people are like, this tastes awful, but okay, you're nodding.
Yeah. No, one of the most important things we always said is it has to taste good. Otherwise you're not going to sustain it. And so, for example, my whole team, me as well, we've been eating plant-based for a really long time. So we, from our own experience, also know what is, how do you make it taste good and what are good recipes, and using a lot of spices and also different culinary kitchens, a lot of Asian influences, Middle Eastern influences. So that was definitely one of the things that we focused on. And I think the cooking workshop was a really good opportunity to show people how tasty it actually is. But in order to also really assess that, we did a process evaluation at the end of the study. So we asked people in focus groups and also in questionnaires, hey, what did you guys actually think of the whole lifestyle intervention? How feasible was it for you? What were the more difficult parts? And from there, we also received a lot of positive feedback that, yes, it is a big lifestyle change, but they're doing it for a reason. And for a lot of people, it wasn't as invasive or difficult as they would have thought at the beginning.
Oh, that's really good. And did you reduce the fat content at all, or were you concerned with, how people are about fat, and everyone always fights over a nutrient, it's whether it's fat, protein, or carbs. People have really strong feelings about those. But what happened in your group?
So when we look at a whole food plant-based diet, we really promoted more plants and more unprocessed plants. And for example, the general plate that we showed them was, for example, ideally you eat half your plate fruits and vegetables, a quarter is plant-based proteins, so all those legumes, and a quarter is those whole grains. And obviously you can switch it up a little bit. And ultimately what you see is a lot of, what happens when you eat like that is you eat a lot less saturated fat. And especially that saturated fat is, for example, what also increases this risk of cardiovascular disease, which is also very relevant for this population because both rheumatoid arthritis and osteoarthritis participants or people have an increased risk of cardiovascular disease. What you see is people eat a lot more fiber, which is also really interesting because this helps with satiation. So while our goal was definitely not weight loss and it was not calorie restriction, we do see that people ate a bit less calories because they're eating till satiety, but they're just full earlier. And for example, we also saw that this is something we did really push for because it's quite important, but there was a slightly less protein intake, but it was at, for example, the recommended daily intake. So you see slight changes in the macronutrients, but in general, healthier shifts towards, for example, more like the dietary guidelines.
And you mentioned this is a diet, you're plant-based and your whole team is plant-based?
Yeah, we're not perfect. We also
You're
don't
not.
expect from our no. We don't expect from our patients either to eat a perfect vegan diet. But yeah, we definitely eat as many plants as possible.
Yeah, I'm similar, by the way. That's how I eat. And I'm so into fiber loading these days. Like it's a TikTok trend. I know it's terrible. I got like my health.
Well, that's a good trend. That's a good trend.
I went on some kid in TikTok. I'm like, that's smart. I'm gonna do that.
I feel like now, I don't know how that is for you guys, but here protein is this big hype and all these products are being pumped with protein and there's protein everywhere. And in general, with a good balanced diet, eating enough calories, you can get enough protein.
Yeah.
But what we do see is people are not getting enough fiber. So
yes,
that's why it's really something, especially eat more unprocessed plants, because that's where fiber is in. That's how you improve your fiber intake.
Yeah, no, you're 100% right. There is a protein kick over here, and there's still the kick of eliminating carbs completely and just eating like steaks and eggs or whatever, which personally, people can do what they want to do. Personally, I could not. I don't think I could do that for more than 2 days. It just does not make me feel good. I don't know how people can consistently do it without getting cravings, but that's just me. I don't know. But it's a huge trend,
Yeah.
and people, like I said before, people feel very strongly about it. I posted recently on Twitter or Facebook. All I wrote was I eat carbs, and people were commenting that's okay, and I'm like, it was just interesting. To see the responses I was getting, because it was like, to some people, I think it was like confessing a sin, even though it should be kind of perfectly normal, like, hey, yeah, I eat carbs.
Yeah, no, especially like, unprocessed whole carbs are
Yes.
incredibly healthy.
Yeah.
They're high in fiber, and the higher the intake, also the greater the, health benefits. And I think the problem is when we cut out a whole food group like carbs, the problem is what are you replacing it with? And as you said, you're eating a lot more meat and certain animal products that are also low in fiber and high in, for example, that saturated fat. And that's what you don't want.
Yeah. And for me too, on my personal philosophy is I'm very against the factory farms. Like when you actually watch some of the documentaries, the people who actually go behind the scenes and see how the animals are treated and raised. And I personally just cannot support that I just don't want to eat that quality of meat. I have much more respect for like a hunter who goes out and, shoots something, takes it home, prepares it and cooks it, like, because that animal is like free roaming and kind of healthy. But my God, some of these things I watch, I'm like, oh no, not eating that. So, but that's just me. Yeah. And social media has made that so much more accessible, to watch. Like, but for me, I'm like, hey, this is where your food comes from. You should know this too, right? Like,
Absolutely. Yeah.
yeah. So let's talk a little bit about some of the results regarding, osteoarthritis and rheumatoid arthritis. Did people feel better?
So when we look at the comparison after 4 months or 16 weeks with the usual care control group and our intervention group, so in the rheumatoid arthritis group, we saw that the disease activity, which we measured with the DUS-28 score, and that's a composite score of the number of swollen joints, number of tender joints. It's based on an inflammatory marker in the blood, the erythrocyte sedimentation rate, and also a general well-being score that's self-reported by participants. That score is standard used in rheumatological care to assess the severity of the disease. So how active is the disease? So that's also what we use. That's our primary endpoint. And what we saw is that this disease activity score, it started at about a level indicating moderate to mild to moderately active rheumatoid arthritis, which was one of our inclusion criteria. So these people had mild to moderately active rheumatoid arthritis. And what we saw is that this score dropped after 8 weeks, but especially after 16 weeks, we saw a significant reduction in disease activity as compared to the control group, which was statistically, but also clinically very relevant. And to put that a little bit into context, this degree of change that we found, you can also see, for example, in improvements in disease activity with good medications. So it really is quite a substantial improvement. And then when we look at the osteoarthritis group, we looked at that WOMAC score, so the pain, stiffness, and physical function. At the beginning, participants had a score of about 40, which is indicative of a mild to severe form of osteoarthritis. And also there we saw after 16 weeks, a significant reduction in pain and stiffness and improvement in physical function as compared to the control group. And yeah, the really interesting thing I think about that group too is there's not that many treatment options. So you have painkillers, you have physical therapy, or you have, operation to replace your joint. So I think this is also very impactful for that group to show, hey, there are additional treatment options and there's really something you can do yourself as well.
Absolutely. That's empowering. And especially, over here when everything is so expensive, regarding healthcare and that kind of thing. I spoke to someone who was doing like hyaluronic acid, like just rubbing it on their joints or something like that as a supplement. And point being, it's a big problem. People are like trying, anything to feel better. But this is good. So you talked about that people felt, reduced stiffness, improved mobility, but you also did those clinical tests. Am I hearing that right? Like, okay, so you were taking blood levels and that kind of thing?
Yeah.
Okay.
Yeah. So those were our primary outcomes, but we also looked at a lot of other things. So, for example, we looked at anthropometric measurements, weight loss, waist circumference. We also put participants in DEXA scans to look at fat, in the whole body, but also visceral adipose tissue, bone density, muscle mass. We looked at various blood markers, so HbA1c, fasting blood glucose, LDL, cholesterol, so a lot of those as well. We also put our osteoarthritis participants in MRI scans and looked at liver fat content. So, for example, one of the significant findings we also found was that in our osteoarthritis group, these people had metabolic syndrome as well. And there we saw a significant reduction in liver fat as well, from 7% on average to 2%. And for context, at 5%, you have non-alcoholic fatty liver disease. So that was one of the interesting findings we found as well, and also indicating that this program, it helps, symptoms and disease activity, but it has such a broader impact, improving the general well-being of these people.
Were some of the factors regarding, weight loss or reduction in hip waist circumference, were those significant?
Yeah. So after 4 months for example, the osteoarthritis group. So this group had a starting BMI of 33. So they were a heavier. Group to begin with. Yeah. And we included, one of the inclusion criteria was that they had metabolic syndrome. So what we saw very clearly there is significant weight loss, significant reduction in waist circumference. I think on average, they lost over 5 kilos after 4 months compared to the control group. We saw significant improvements in LDL, HbA1c, fasting blood glucose, reduction in insulin, and then also this liver fat reduction as well. And we also saw these changes in the rheumatoid arthritis group, but this group had a healthier BMI to begin with. So we saw, for example, I think they started at 26 BMI. We saw that there was also these improvements, but to a smaller scale because they didn't have to lose that much.
And I would imagine losing the weight helps with the joints and movement.
Absolutely.
Too, right?
Yes, for sure. Yeah.
For sure.
Yeah. And that's a question we get a lot from, is it then just the weight loss?
Right. Yeah.
And we did, for example, a mediation analysis to assess that. And even after, for example, in the osteoarthritis group controlling for the weight loss, there still was a significant effect. So I definitely think the weight loss plays an important role, but there's more going on than just
it's not the whole effect. That's what
exactly.
You're saying.
Yeah.
Well, that's amazing. And did anything surprise you?
Honestly, a lot of things surprised me. I think just how good some of these people really felt afterwards. Did we have a lot of testimonials, people that, used a lot of painkillers, used a lot of medication. And after, I wouldn't say after 16 weeks because we kept the medication stable, but 1-2 years later, medication free, certain people were completely in remission. One young participant, her rheumatologist was like, I don't have to see you anymore because, it's not that you don't have the disease, but your disease activity is this low that even without medication, it's fine. So I think that's so incredible to really witness. And I think one of the really interesting things we found too is, and these are anecdotes, but there's certain individuals that indicate if I eat something really fatty or some meat, for example, or a lot of sugar, the next day I feel it in my joints. So these people indicate I get almost instant swelling and pain, which is such a negative feedback loop for them to keep adhering to this plant-based diet. And I think we never would have imagined that it's this powerful.
That's incredible. And just, you mentioned you had a young patient. What was the age range for your study?
It was quite a broad range. I think the youngest were in their 20s and the oldest were in their 80s.
Wow.
So on average, our rheumatoid arthritis group had an average age of about 55 and 63 in our osteoarthritis group.
Okay. And you saw this effect across the age range.
Yeah. It's always like that, but it's not everyone that's going to have this drastic effect. Obviously,
Of course.
the people are indicated are, the most, impressive results. But in general, on average, we saw those significant reductions.
Yeah.
So
yeah, I like sharing anecdotes on podcasts just because people do like to hear stories. And I know they're anecdotes. We all get that. Some doctors are like, it's an anecdote. It's like, calm down. Like, we know, we said it's an anecdote, but like people still like to hear personal stories. Um, so at the beginning, you kind of talked a lot about inflammation. Is that the theory behind why you have such a success here?
I think it's kind of the red.
Reducing.
Yeah, exactly. Yeah. And when we look at but there's different things that cause this inflammation. So for example, the weight loss also reduces inflammation. So I think that plays an important role. Physical activity also reduces inflammation. Stress, reducing it also reduces inflammation. When we look at the different lifestyle aspects, the greatest change was in their diet. And I think one of the important factors there is this increase in fiber intake. And especially one of our main hypotheses is that by increasing this fiber intake, you're also modulating the gut microbiome. And for example, we know that high fiber diets, very plant-based diets, they can modulate the gut microbiome. And there's certain bacteria that ferment these fibers to short-chain fatty acids. And these short-chain fatty acids are a food source for our colonocytes, so the cells in our gut lining, which help ensure that this gut lining is intact and reducing any potential leakiness of cells or metabolites through the gut lining that shouldn't be happening, because that's one of the sources of inflammation. But also these short-chain fatty acids are also absorbed and consequently also help with lowering inflammation as well. So that's one of the main things we're also looking at. And for example, we've also done initial analyses in the gut microbiome, and there's some indications also that we see beneficial shifts. And also we do have indications that we do see improvements in this gut barrier function as well, which does support that hypothesis.
Yeah. Now, what did you tell them to do for reducing stress?
That's a good question. That's, I think, one of the harder components to also measure, because we gave such broad advice, because I think stress is very different for a lot of people. And I think there's certain people you can tell, hey, go meditate, but for others, that's really not going to work. So in general, we told people, find something that works for you. And our ideal guideline was that they did that activity or something like that for 10 minutes a day for about 6 days a week. So that for someone that could be, a yoga exercise, for someone else that could be a, gentle walk in the park or meditation.
No, and that's the same kind of thing with diet too. Like, you're not going to eat something for a long time if you hate it. Just like with a workout, you're not going to do the treadmill if you hate it. Like, you have to find something that works for you. So that makes total sense when it comes to stress reduction. Now, did you give specific sleep tips, or did you tell them to go to bed at a certain time and wake up, or Not sleep with your
As,
phone.
yeah, we gave them a lot of sleep tips and sleep hygiene tips. For each of the lifestyle components, we started off giving some theory. So, what's the importance of eating fiber? Why should we be exercising? Also, what does sleep do with our brain, and how does, for example, the sleep cycles work? How many hours of sleep per night is ideal? And that can differ per person. Various tips that we gave them was, for example, having, waking up at the same time, going to bed at a similar time. What time that is for someone doesn't matter, but as long as they have some kind of routine, if possible. A dark bedroom, so having like light blocking curtains, as you said, no telephone or very thrilling book or TV show you're watching right before you go to bed. That kind of tips.
No, I love that. The thing I'm noticing now with the phone, because I live in New York City, is like how many people just like are walking now and just staring down at their phone. And then I'm like, in my head, I'm thinking, okay, how often is their neck in that position? And they're starting at younger and younger ages. And I then ask myself, what is that going to look like 30 years from now? Like, what does that do? Like you just wonder what all this technology is going to do to not maybe joints, but maybe joints, but like our posture, like, are you going to be able to lift your head? Like, it's funny what you think about when you're just observing what people are doing.
Yeah, and I think especially on the mental health aspect, I think we're seeing that
Oh
now more
God.
and more.
Yeah.
It's not good.
No, it's not good. And it's not good because of how they set up the algorithm too. Like the stuff that you get is the most extreme and most absurd. And then if you click on one thing because you're curious, because you're a human, and then all of a sudden you get like more like that. And my sister did that. She ruined my Instagram feed for me because she starts sending me reels that are like, I mean, I just sit there with my mouth. I'm like, what? Like, huh? Like, like, how is this a thing? And then all of a sudden I go to my homepage and I have like 50 more videos like it. And I'm like, okay, like I'm gonna read a book now. You can go back to the Stone Age and read a real book. Um, but anyways, that's a whole other thing. I wanted to ask you though, because we are talking a lot about weight loss. And over here there's a lot of chatter about I'll say new weight loss medications, or of people getting prescribed, these medications, and everyone's like, "Oh, this is our miracle moment, these are miracle drugs." Lots of people are taking them. Is that how it is over there? Is there a general sort of enthusiasm for these drugs, or is there more caution? Is there equal focus on prevention for obesity? I'm just curious what your take is on that.
I don't know if it's the same, uh, the same amount as you guys are having. I think there's, at least for us, there's certain whether it's type 2 diabetes or conditions where it's covered by health insurance. So for some people, it is covered for health insurance, but you're also able to get it with a doctor's prescription. But then you have to pay for yourself in certain situations. So there are definitely people using it. I think on the one hand, I think it's, a really great advancement because I think for certain types of people, it's, whether it's genetic or they've tried everything and it really doesn't work. I think it's really great that there is something that can help them, attain a healthier weight, which is ultimately, what we all want to improve their long-term health. One of the things that I just hope it doesn't do is that people take this drug and they, still don't move, exercise, still, eat unhealthy. That's one of the things I really hope doesn't happen because I think they can, really support each other synergistically. And I think there's more and more evidence coming out as well that you really do need to have that focus on lifestyle while using these drugs. And then I think they are, for certain people, very important and complementary to each other.
Yeah, no, I tend to agree with you. And I also, they've been getting so much attention in the media and stuff like that. And I'm just like, I wish we could do that with prevention too, whatever that would look like for folks and put all of that media hype and headlines on prevention. It's just not as sexy, but if there's a way to make prevention sexy, then maybe it'll get, in the news more and get people excited about it. That's always the problem though in public health though, right? Like, how do you make prevention sound appealing and sexy? That's tough to do. What would you say to someone who hears the word plant-based words, plant-based, and says to themselves, that's too restrictive.
I think the most important thing is that every step towards eating more plants and less processed is great for the health. So if that's, once a week, a meatless Monday, or adding fruits and vegetables to every meal, those are really good steps that are, will in the long term make a big impact. But we do see from, large cohort studies, is that the more plant-based people eat, the healthier they tend to be. So the lower weight, the lower risk factors they tend to have. So yeah, my advice is always, do the best you can, see where you are now, make small steps. But I'd rather people, do it that way than that they go 100% vegan, they do it for a couple of weeks and that they're like, all right, I can't do this. And that they fall back into their own patterns, or their earlier patterns.
Right, right. Small steps. You don't have to go cold turkey into plant-based and
No,
and
no, and
maybe
I think we tend to really make everything black and white.
we do.
Like, no, okay, no carbs, or no animal products anymore. But
Yeah,
it really doesn't have to be like that.
I know. But we're like getting worse and worse at nuance for some reason. Like, I don't know if that's reverse evolution. Like, my brain tells me it should be the other way if we're getting smarter, like more kind of acceptance and able to embrace nuance. But it just feels like we're going backwards, Like, oh no, you're either this or you're that. Like, I don't know what that is. I
I think
don't.
there's so much information out there that people are really just, they want
Yeah.
something concrete to hold on to.
Yeah. Like
So
the
I
easy
think for them,
label.
it might be, yeah, it's an easy choice. Okay, for me, I'm just going to cut this out, for example.
Yeah.
Um,
Yeah.
and
Yeah. I tend to embrace the nuances and the gray areas, which also drives people nuts. And I've noticed that in some conversations. They're just like, well, can't you just tell me to do it or not do it? And I'm like, no.
yeah, yeah, and it's
I gotta go
like,
to
as I
Walden
said,
Pond.
yeah. No,
Finally.
but yeah, as I said, like, I've been eating plant-based for a long time, and then
Yeah.
sometimes I have a piece of cake and someone's like, "Oh, you can't eat that," and I'm like, I can do whatever I want.
Yeah.
It's not, again, it's not black and white, and this is a choice I'm making in the moment, and
Yeah.
that's totally fine. But I think it is hard for people to grasp. Okay, then what is moderation, and what is that nuance?
Yes. There is something missing, which, in like the more meditative circles, they call flow. Just that ability to kind of adapt, know that like one decision is not going to kill your entire diet plan. You don't have to be so rigid. Like you just get to this like position or condition of flow where it's like, yeah, no, I'm going to eat that and I'm going to be fine. And, this is who I am and it kind of fits in here, but we're not really like that yet, but maybe one day.
Yeah, I think if a lot of people realize that what you do day to day and that basis that you
Yes.
have, that's the most important.
The
And it's totally
habits.
fine. Exactly. It's totally fine if once a week or more often, whatever fits within your goals as well, because yeah, why are you doing something? Like, what is the
Yeah.
reason that you want to make a certain lifestyle change?
Yeah.
What fits within your goals?
Right.
And if having, something more unhealthy once in a while fits within your goals, which I think it should,
Yeah.
that's totally fine. But I think it's learning about that, and you're gonna encounter, moments where you make some mistakes, but you
Yeah.
learn from it. And I think the most important thing is getting back up and reaching back for that, healthy
Yeah.
basis and going from there.
Yeah. And even in those moments of mistakes or wickedness, like you still need to have joy in life. Like sometimes we don't talk enough about joy, but life is short. Life is short, guys. Like you need to have joy and enjoy what you're eating, enjoy what you're doing. And, that's that. So,
Absolutely. One of
so
the
go ahead.
things we also told our patients was find a delicacy that's really important to you that you're just not going to give up. And that can be, for example, there's one patient that once a month he goes to the snack bar and he gets, I don't know how many hot dogs, and he eats them all. He loves that. And we're not going to take that away from him, and that's totally fine. And for the other days, he eats his vegetables, he does everything quite right. So I think that should also be encouraged. Find something for you that, is really meaningful, and just enjoy it. Just actually really enjoy it and don't feel any guilt about it. Because once in a while, it's totally fine.
Absolutely. And as someone who used to be too rigid in the past about like my diet and exercise, like it's not, I don't think it's great for the long term. You do need to think about enjoyment and yeah, just being able to smile, kick back and relax and not judge yourself so harshly. What are next steps for Plants for Joints? Are you guys doing other studies or I mean, I think it's great. I hope it continues because I love the name and I think it's phenomenal. Like the results you're getting are good. It can help a lot of people. What's next?
So after those first 4 months, we did a couple additional studies as well. So we did a 2-year follow-up. So after the first 4 months, the control group that had usual care, they got the same intervention, and then everyone was followed up for 2 years. And what we see in the long term is that this improvement in disease activity and improvement in pain, stiffness, and physical function remained at the same improved level throughout the 2-year extension study. And on top of that, we saw a net reduction in medication. So a year after the end of the intervention in the rheumatoid arthritis group, we saw that 50% of people using antirheumatic medications were able to reduce or stop their medications with an average dosage reduction of 62%. And then in our osteoarthritis group, we also saw that of those taking pain medications, 66% of people were able to reduce or stop this. And in terms of cholesterol medications, 44% of people were able to reduce and stop this. So that, as well as the maintained reduction in disease activity or symptoms, as well as a maintained adherence. So that's one of the additional studies we did. And I think that's also really important to show that, you know, a lifestyle like this is feasible, but it's also sustainable throughout the long term, which is also the feedback that we received from our process evaluation. So given all that information, one of the or a lot of patients, they actually told us, you know, you need to do something with this. And we also had a lot of rheumatologists saying like, okay, you know, how can we now advise our patients? What can we do? Where can we refer them to? So my colleague and I decided, all right, well, maybe we should try to implement this within healthcare. So what we're trying to do now is get it covered by health insurance. And in the Netherlands, there's a format called a combined lifestyle intervention. And this is a lifestyle intervention that has to comply with various criteria. And if it does, then we can get it covered by health insurance, we've been working on it for about 1.5 years, but we're almost there. So we're really excited about that. But in the meantime, we also wanted to offer something. And to do that, we started a limited liability company. So a social enterprise, really with the goal of making this program available to everyone. And when I say everyone, I'm not just saying people with rheumatoid arthritis and osteoarthritis, also because of the beneficial effects that we saw. Previous studies showing that an intervention like this works for cardiovascular disease, is effective for type 2 diabetes. We called this company Plants for Health. And what we're now doing with Plants for Health is we wrote a book. So during our 16-week period, during our study, patients got recipes and they got a lot of theoretical content, as kind of handouts. So we thought, okay, we need to professionalize this. So we wrote a book, Plants for Health. And we also have a supporting program, which is completely online, that actually allows people to follow this program in their own pace at home, but also with the support of experts and also community online. So those are all running in the Netherlands right now, but we've also translated the book, for example. So the book will be available from November onward. And we hope that the English version of our program is also available from the start of next year.
Oh, so the book, you can get it in English in November?
Yes.
Oh, I love that. I'm gonna definitely read it. And there's like recipes and stuff in there and the whole
so we
program. I love
Yeah.
that.
Yeah. So we have the various lifestyle components. So the food, movement, sleep, stress. We have training schedules. So I have a background as an athlete as well. So together with a physical therapist, we made strength training for people to be able to do at home for various levels. But we also have over 70 recipes that we all have tried, love, with accompanying meal plans as well. So people really can just use that as a starting point to make some lifestyle changes.
So what is the website? Is it? plantsforhealth.com.
Yes. Yeah. www.plants
Yes.
and then little stripe health.com. Yep.
Oh, I love that. I mean, and if I go, well, I could translate it, right? It's in Dutch, I guess.
It's in English. No, we have a Dutch one. Yeah, yeah.
Oh,
So
so
right now we have the
I'm
English.
so American. I'm like, I need it in English.
No, of course, of course.
That's all we know.
Yeah, no, Dutch is it's not easy to read if you can't understand it. So no, so our English program or website is live, and there you can also sign up for our newsletter, and then we'll keep everyone up to date when the book launches and the program launches as well.
I love this. Yeah, I love it for so many reasons. Like, one, you have the research done and published and in humans, and that's great. You have follow-up that's, years out. That's great. And it's something that anybody can really do, kind of with within reason, with any level of incomes. And it's great because everyone always is selling supplements and this and that. And this is just evidence-based, accessible, and just something that anybody can really start whenever they want to. So that's really good. It's great.
Yeah.
Good for you.
Thanks,
Yeah. Congratulations to you and your team. I will share the website, and I will read the book. I look forward to that. And I'm curious. And I encourage my listeners to do that too, especially anybody who's struggling, with joint pain, stiffness, or weight in general, right? All these things a lot of people are struggling with. What do you hope the impact is of this?
I think one of my main goals is just giving people a more feeling of control over their health. And I think that's also why I got really interested in, lifestyle in general, is just the impact that you can have on your own health to keep yourself healthy and to prevent disease where possible. I think we live, in uncertain times, and I just think it's very cool that there's something that you can really do yourself that has such a big impact. And obviously things happen and we can't predict every outcome, but you can dramatically reduce your risk of various conditions. So I really hope to give people the tools in order to really gain more control over their health and over their disease.
I love that, Carlijn. And you're obviously very motivated, and I can tell you're very passionate about it, which is phenomenal. It's so good. Will you email me the book when it's out in English?
Absolutely.
Yeah, okay, good. Because I want to make sure I'll share it with everybody, and I'll put it in my newsletter. But thanks so much. And are you researching now, or are you also seeing patients?
Right now, I am only still working on the research and plans for health. I do think I want to go into primary care. So next year I'll be looking into in the Netherlands you don't have to go straight into residency. You can kind of dabble.
Everybody's a little different.
Yeah. So but the thing I like about primary care is that you really see people while they're healthy, and you can tackle a lot of risk factors before people might have a chronic disease. So I think that could be a really nice space.
Yeah, no, absolutely. That's true. But what you're doing now is kind of like public health, right? Like it's a public health initiative and just getting the word out and stuff like that. So anyways, fantastic. This was great. I'll share the website. If there's anything else that you think I should share, just email me and then let me know about the book when it comes out in English.
Great, will do. Well, thanks so much for letting me talk about our study. I always love doing
it was
that.
Great. It was great. I'm excited about it. I'm excited for you. I hope it takes off. So I'll share it over here, start spreading the word in the States. So I do have a lot of podcast listeners, so they'll check it out for sure. You can see, you can go to the back end. You'll be like, oh, there's somebody from, backwoods, Pennsylvania.
Love that.
All right. Enjoy the rest of your day there. Bye.
Thank you. You too. See you.
All right. Thank you, everybody, for joining in for this episode of Causes or Cures. And a big thanks to Dr. Carlijn Wagenaar for walking us through the nuts and bolts of Plants for Joints. Definitely check it out. And, for reminding us that skills in the kitchen can be just as therapeutic as scripts in the clinic, if not more. Food is thy medicine, right? That's someone old and dead and smart said that, didn't they? All right. And now it's time for the closing quote. And this one is from Michael Pollan, and it's really short and sweet and super relative. Here it is. Eat food, not too much, mostly plants. Mostly plants. All right. And that is it for today. Don't forget to subscribe to the podcast. If you can rate it and leave a review, that would be awesome. Thank you so much to everybody who does that. And don't forget to subscribe to the newsletter. And, where I'm including interviews in there now. And there's going to be some deals because I've paired up with some folks as a partner or affiliate, whatever you want to call it. Not on anything quackerific, but stuff that's like good, like for a healthy lifestyle type of stuff. So if you are into that and want deals, subscribe to the newsletter, and the link for that is in the show notes. That's it for today. Go out and do good things and have a good time and be happy wherever you are. Goodbye for now.